Good afternoon, and welcome to today's Lunch and Learn webinar for the Iowa Pediatric Mental Health Collaborative, Why Sleep Matters for Adolescent Mental Health, presented by Dr. Bengi Baran. My name is Coffee Dixon, and I'll be moderating the session today. I will cover a few housekeeping items before we get started. Following the presentation, we'll have time for questions. Please use the Q&A feature in the webinar toolbar, and we will cover as many questions as time allows. The webinar will be recorded, and the link will be shared in the follow-up email. Instructions for how to claim credit will be uploaded to the chat, and I will also send this information in the follow-up email after the session. So without further delay, it's my pleasure to introduce our presenter today. Dr. Baran received her PhD in psychology from the University of Massachusetts Amherst, where she studied the effects of aging on the cognitive function of sleep. Then she went on to complete postdoctoral research training at Harvard Medical School in sleep and psychiatric brain imaging. Prior to establishing her lab at the University of Iowa's Department of Psychological and Brain Sciences, she was appointed as an assistant professor at the Psychiatry Department of Massachusetts General Hospital, where she studied sleep-mediated cognitive deficits in people living with schizophrenia. She is interested in understanding the role of sleep in the etiology of psychiatric disorders. A specific focus is on identifying sleep-related biomarkers of risk for psychotic disorders using functional connectivity magnetic resonance imaging, MRI, or sleep EEG, and clinical and cognitive assessments. Dr. Baran's work has been funded by the National Institute of Mental Health, Iowa Neuroscience Institute, and through philanthropy. So welcome, Dr. Baran. I'll turn it over to you.
Thank you so much, Coffee, for organizing this and inviting me. It's always an honor and privilege to be able to share the work that's coming from our tiny labs with the general community, hopefully to make impact of this research. So my overall interests are very broad in terms of understanding the functions of sleep, but a very recent theme in my lab, which I'm quite motivated to continue, is to understand the role of sleep in the context of youth mental health. And that's why I've been particularly interested in sharing these new lines of evidence with you all. So we all know adolescent mental health problems have risen alarmingly in the US in the last 50 years, although the last decade has seen the most significant increases. These trends come in with increased media coverage, scary media coverage, with new studies, not unlike to use words like crisis and life or death. And these are sometimes discussed in the context of COVID, but the increase in mental health trends have long preceded the lockdowns and social isolation that began in 2020. In fact, medical experts and policymakers have all been alert about this. American Academy of Pediatrics has declared a national emergency in adolescent mental health a few years ago at this point, and so has the US Surgeon General. Today, I'll try to take a more targeted approach to youth mental health and focus on the role of sleep in emotion regulation and mental health. And before I go further along, I'll show a video that I found on the internet where these two siblings will be discussing the importance of sleep. So, what they talk about is actually the take-home message of all that I will be talking about today. Did you have a nap today? So hopefully you got to hear this. What the siblings are saying, the older sibling is saying, "Did you get your nap today?" And she's like, "No, and I don't need it." So this tells so much about the emotional problems, the emotion regulation problems, and insistence that comes with lack of sleep. Um, so it is not uncommon in my line of work to come across such statements like sleep seems like a perfectly fine waste of time, Why would our bodies evolve to spend close to one-third of our lives completely out of it when we could be instead doing something useful or exciting? And the underlying sentiment here is that why waste my time sleeping? And it's so fundamentally wrong, right? So sleep is essential and is inevitable and serves critical functions such as conservation of energy. Resting and recuperating are one of the primary needs that are met during sleep, right? Thermoregulation, regulating our body temperature, cleanup of toxic byproducts accumulated during the day. So that involves both the lymphatic and the glymphatic system. So cleaning up of toxins from the body and from the brain are equally important. We can think of sleep in some way like flushing the toilet at night. But what I will focus mostly today about are the critical functions sleep serves with respect to brain development, cognition, and emotional regulation. So let me start by very briefly summarizing how sleep changes throughout development. And let's start with early development, with infancy and toddlerhood. What I'm showing here in this graph is that, hold on, let me just set up my arrow here. What I'm showing here in this graph is that sleep shows a great deal of variability early in life. For a newborn around 1 month of age, you can see as little as 9 hours of sleep at night or as much as 19 hours of sleep at night. Both of these are extreme outliers, but the message that I'm trying to convey is that there's so much variability in how much a child sleeps, evident for the first, particularly for the first year of life, which funnels down. By 6 months of age, babies start to have adult-like sleep stages, characteristic of rapid eye movement, REM sleep, and non-rapid eye movement sleep. Sleep is polyphasic in infants and toddlers, meaning that they not only sleep at night, but they also have multiple bouts of naps during the day. And they have a very strong sleep drive. Infants and toddlers fall asleep quickly when sleep deprived. So it doesn't matter however interesting thing you're engaging with them, they will fall asleep if their brain needs it. As we go older in development, what I want to emphasize is that naps support cognition and emotion regulation in early childhood. But most children stop napping sometime between ages 3 and 5, and it depends on individual factors for when they when their bodies and brains decide to drop this nap. And until naps drop naturally, missed naps have been linked to worse mood behavior and problems with learning in this age group. In little children, night awakenings are common and neurodevelopmentally expected. In the sense that these frequent night awakenings, although extremely frustrating to parents, have been linked to the emergence of important developmental milestones, such as improvements in mobility, being able to climb out of the crib, right? And things like emotional milestones, like development of separation anxiety is linked to frequent night awakenings and crying for mommy and daddy. With respect to middle childhood, at this point, sleep patterns become relatively stable. They become trait-like across childhood, which means that a child that's a short sleeper or a crappy sleeper at age 3 is going to continue being a short sleeper later at age 7. There's no single right sleep duration for all children, and I try to emphasize this throughout my presentation. And individual differences in sleep need are real. For instance, I won't spend too much time on this, but these are 4 different study samples and fairly large study samples, which find quite a bit of variability in the duration of time and also onset of sleep time. Early signs of chronotype, meaning morning versus evening preference, begin to emerge in middle childhood. So whether they're more of a night owl versus morning lark. You can see hints of that. And with all of these individual differences combined, and differences in terms of when children reach certain milestones, developmental milestones, a fixed ideal bedtime for children at a given age does not exist. But today, we're not here to talk about early childhood. We're here to talk about sleep in adolescence. A metaphor has been introduced for sleep in this age group, the perfect storm. And I'll try to unpack why it is considered a perfect storm in this age. So I listed brain development as one of the critical functions of sleep. And for this reason, getting the right amount of sleep the body needs is more important in sensitive periods of development. Adolescence is a time when the rate of brain maturation peaks. And it's not a period of development of individual brain structures per se. Rather, it is the critical fine-tuning of large-scale brain networks that serve higher-order functions such as judgment, decision-making, and emotion regulation that peak in maturation during adolescence. Um, that said, adolescents do not get enough sleep. There's so much research evidence, as well as anecdotal evidence, clinical evidence that points in this directions. I will show you the results from the Sleep in America poll from a few years ago, which had tens of thousands of respondents across the USA. And what they show is that it dramatically reveals that less than 20% of 12th graders are able to sleep 8 hours or more during school days. And that is definitely not enough. I will try to emphasize this throughout that a sleep need in adolescence is not different from sleep need in pre-pubertal children. And again, I'll try to support this, back this up with research evidence. For instance, there has been a longitudinal study which gave uninterrupted sleep opportunities, 10 hours of sleep opportunity to adolescents, pre and post-pubertal children. And when they're given this room with the door closed, the lights are off, adolescents sleep around around 9.5 hours, irrespective of the maturational stage, pubertal maturational stage. So if they're given the opportunity, they do sleep. Another way of looking at the fact that there is sleep need that is not met is with the multiple sleep latency test. So multiple sleep latency test, or MSLT, it's a very lengthy procedure. It's a full day test that consists of 5 scheduled naps throughout the day. During each nap trial, the individual will be lying quietly in bed with electrodes attached, and they try to go to sleep. And what they're trying to see, what the clinicians are trying to see, is how long it takes the person to fall asleep when given this nap opportunity. If they cannot fall asleep within 15 to 20 minutes, they're taken out of the room, and then a few hours later another sleep nap opportunity arises. So as I said, once the lights go off, the test will measure sleep onset latency, how long it takes to fall asleep. Shorter time to fall asleep means two things. There's increased sleep debt, right? So they need the sleep. That's why they're falling asleep right away in the middle of the day. And it also shows increased daytime sleepiness. So it could be diagnostic of sleep disorders like narcolepsy, for instance. So across several studies, what has been consistently found is that it takes on average 11 minutes across these 5 naps scheduled during the day to fall asleep. Anything shorter than that is indicative of sleepiness. So with this particular study in 10th graders, average sleep latency was 5 minutes, which corresponds to patients with severe obstructive sleep apnea or another study that found that this short of a sleep latency was in anesthesia residents. And I won't get into medical training and not having enough opportunities for sleep. I can complain about those in a different session. Um, Importantly, about half of the sample of these 10th graders fell asleep in less than 2 minutes, so showing really severe daytime sleepiness in this case. So, two lines of evidence so far that the sleep need does not change. Another is that there's a highly observed pattern of sleep debt in the sense that there's quite a bit of a difference in terms of sleep duration during weekends versus weekdays. So their bodies need the sleep and trying to make up for lost sleep by extending sleep time over weekends. Right. So let's now talk about why adolescents cannot get enough sleep, their needed sleep. I'll try to unpack these reasons, and I'll start with the biological reasons, right? So you may have heard the term biological clock, the chronotype, as I mentioned, which changes dramatically with puberty. So, compared to prepubertal children, adolescents are more likely to be categorized as the evening time. So, their brain's preference is to go to bed later and to wake up later. So, I won't get into the specifics of the metrics here, but this is a study from more than 25,000 people looking into chronotype. Night owl versus early bird preferences. And what you see is the sharp trend that happens in the for a delay of this marker from ages 10 to 20 with girls initially, with females initially leading males, as would be expected if this trend is related to pubertal development. So chronotype changes and it tracks pubertal development. It happens earlier in females than males. Another important biological change is the reduction in the sleep drive. This is also very important. So it is very challenging for young children to try and resist sleep. They just cannot. However, it becomes much easier for the adolescent brain to do so. Their sleepiness threshold increases following puberty. So we accumulate sleep drive throughout the day, and it reaches a personal, individual threshold for a person to become very sleepy. The brain regions involved in sleep onset get triggered, and the person starts yawning, starts secreting melatonin, and wants to go to sleep. This sleepiness threshold is delayed with adolescence. It's a very normal developmental marker. But there's also important critical psychosocial reasons for why adolescents cannot get enough sleep. For instance, they have increased need for autonomy. They want to make their own decisions. Peer interactions become much more important in adolescents than in young children. And they want to spend more time interacting with each other. School demands also increase with this. There's early morning practices, late evening practices, etc. There's lots of extracurricular activities. Employment comes into play, and I'll spend more time on this. But screen time and technology use in the evenings also interferes with sleep. So let's pause for a second here and talk more about melatonin. Melatonin is a natural hormone that signals bedtime to the brain. So what happens is that when melatonin production is almost non-existent throughout the day, and in a couple of hours before the intended bedtime, the typical bedtime of the person, they start secreting melatonin. Melatonin production is strongly influenced by light stimulation of the retina of the eyes. What I mean by that is under normal circumstances, exposure to sunlight during the day tells the brain to be more active and alert, but dim light in the evening and complete darkness at night tells the brain to initiate and maintain sleep, and the messenger that tells the brain to initiate and maintain sleep is melatonin. What our brains and what our eyes are not prepared for are instances like this, right? So, right now, at this point, it is well known that blue light exposure from screens suppresses melatonin production and makes it much more harder to initiate sleep. Okay, so let me go back to my metaphor of the perfect storm of adolescent sleep. I talked about the biological reasons that push the child toward a delay in bedtime. We also talked about psychosocial pressures that again push in the same direction of delayed bedtime, right? All of these are happening in the context of a societal pressure right in the opposite direction. Despite all these factors pushing for a later bedtime, a consistent finding for most US states is that school start times move to earlier during the transition from middle school to high school. As you can see from this map, Iowa is doing much better in the context of other states, but still what they need is delayed school start times. So, adolescent sleep becomes the perfect storm when the brain and the social environment of the youth is changing in a way that shifts them towards a delay in sleep time, while the societal pressure is in the opposite direction. This model was first proposed in early 2000s when social media and smartphones were not even quite in the picture. So now you can imagine that insufficient sleep is much more pervasive. So, what are the negative outcomes associated with insufficient sleep in adolescents? Attention deficits, immune system compromises, metabolic problems such as the higher incidence of obesity, traffic accidents, substance use or misuse of medications, and mental health problems, just to name a few. Um, I also want to take a more important focus on social media use and screen use in this age group, particularly because I got several questions about this, and there's newly emerging work from my lab that points at this direction. Um, and this is motivated because of the fact that experts and policymakers have been pointing to screen use and social media as the culprit for the youth mental health crisis. The timeline fits quite well. Mental health problems have gotten particularly worse after the introduction of social media platforms. The previous US Surgeon General even suggested that social media platforms should come with warning labels, just like those on the packs of cigarettes. And both at the federal level and state levels, there's a move towards linking social media use to mental health problems. Social media use is ubiquitous. Nearly all US adolescents use social media for an average of 3 hours per day. A third of adolescents even report using it almost constantly. But social media encompasses a complex set of experiences that may influence the formation of self-identity and peer relationships necessary for psychosocial development and mental health in youth. So some aspects of social media may be particularly beneficial. What are they helpful for? Identity exploration, autonomy, friendship, peer acceptance. And this may be particularly, social media may be particularly beneficial for adolescents with symptoms of mental illness. For instance, adolescents with social anxiety, depression, or loneliness may benefit from interactions on social media that allows them to practice greater control and review of social interactions as opposed to those that happen naturally. Members of marginalized groups based on race, ethnicity, gender identity, sexual orientation, ability status may also find support in social media, which may not necessarily be available to them in their community. Also, for instance, for youth in rural areas, social media may fill a critical gap in peer interactions, which otherwise may not be available. Social media has also increased access to mental health related content. And I want to pause here a little bit. Youth have better access to others who may be having similar experiences about mental health. Increased support and information eventually helps reduce stigma. But, and there's always a but, there are concerns about the accuracy and the representativeness of social media content with regards to mental health. Just as an example, I teach upper level psychology and neuroscience majors here at the University of Iowa. So these are adults who have received training in how to access objective, peer-reviewed scientific information. And still, it is quite often that I get comments like, I learned about it on TikTok. To which my response is usually this. Young folks with no background in health sciences or journalism start creating 2-3 minute videos on psychopathology, neuroscience, or sleep with such poise and confidence and clarity, which doesn't always convey the science accurately, unfortunately. So there's a lot of misinformation that comes from social media as well. Okay, so now that I provided you with some background information that the increase in mental health problem in youth have been happening in parallel to increases in the use of social media platforms. Let's just dive further into this, which is something that I got quite a lot of questions about. One of the first things that I learned during my training is that correlation does not necessarily imply causation. So the question as to whether social media use causes mental health problems in youth is a very challenging one to answer. And I'm a sleep researcher, and my intuition is that sleep disruption provides the missing link for how social media use might be connected to mental health problems. So I'll walk you through a study that we recently completed. This started with a baseline lab visit where we did a full clinical diagnostic interview with adolescents and their primary caregivers to have a clear and accurate picture of any mental health problems they may be having. We also collected several self-report measures of sleep and mental health. Then we continued this with 2 weeks of real world monitoring. So we had them wear these actigraphy watches, which provides us with an objective measure of their sleep duration and sleep quality. We also tracked social media use on their phones, and we measured their daily mood and affect through surveys that we pushed through their phones twice a day. So this was a study on adolescents aged 12 to 18. We had a fairly good sample. We collected data from 85 children, adolescents. I want to give a sample snapshot because that also tells a story by itself. The average age was around 16. We recruited from the Iowa City Community School District high schools and University of Iowa freshmen. the majority of the sample, approximately 60% of it, was female. And they showed a wide range of sleep and social media use patterns. Of this sample, 33% showed excessive daytime sleepiness, which was above a clinical threshold. Of those that we interviewed, 18% fit DSM-5 criteria for a current psychiatric diagnosis. I will emphasize that this was a community sample. We did not include or exclude based on any diagnosis. We also showed substantial variability in daily social media use duration. We had several individuals who did not use social media at all, to youth who were using social media for more than 6 hours per day. The average was very similar to national averages, around approximately 3 hours of day of social media use. And this is not broadly phone use, screen use. This is specific to social media platforms, I have to emphasize. So, long story short, let me just give you a summary of our primary findings. We found a close link between objectively measured sleep with these watches that they were wearing and mental health problems. But what was quite interesting is that, so let me just take a moment here. Because we use these watches, we had several measures of overall sleep quality and duration. Of these metrics, what we found to be most important for mental health was variability in sleep duration and quality, particularly with respect to weekend to weekday differences. So less regular sleep was associated with higher endorsement of psychopathology symptoms. And importantly, this effect was consistent across all levels of social media use. What I'm plotting here is the relationship between sleep duration variability and psychopathology, divided by children who were using social media a lot, about average, and very low. And this was just just to reiterate, the relationship between sleep duration, sleep regularity, and psychopathology was not moderated by social media time. And we found no direct links between time spent using social media and mental health. This was also the same, and perhaps more convincingly, for daytime sleepiness, self-reported daytime sleepiness. The more sleepiness they had during the day, the more psychopathology symptoms they had. And again, how much they use social media had no impact on this relationship. So because the majority of our findings with respect to sleep were related to lack of regularity of sleep, I want to take a moment to focus on and define social jet lag. It is the mismatch in terms of weekday to weekend sleep onset times, wake up times, and sleep duration times that we call social jet lag. And this creates a misalignment in our brain and our bodies. So what I'm plotting here across a subset of our sample is the degree of social jet lag and mental health symptoms. What you can see here, this is measured in minutes, how much of a misalignment between weekends and weekdays. We have some youth in our sample who show approximately 3 hours of a mismatch between weekends and weekdays. Come to think of it, this is pretty much like traveling East Coast to West Coast every single weekend, right? Every single Friday night, as if they're experiencing this kind of travel. So let me continue with our primary findings and their implications. We found also that this sleep disruption is more strongly linked to behavioral or externalizing problems in contrast to internalizing problems, things such as mood problems, depression, and anxiety. It was a weaker association with internalizing symptoms. We also examined day-to-day relationships to see whether day-to-day fluctuations variations in sleep or social media use have impacts on day-to-day fluctuations in mood and affect. And what we found was that better sleep was linked to better next day mood. So now we're finding a causal link here across the sample. We also found that poor sleep was associated with increased next day social media use. So, one of the key takeaways from this study is that sleep regularity appears to be more important for mental health than time spent on social media. And we believe, or I believe, this is important because majority of the interventions and policies are focused on limiting time spent in social media. For instance, school cell phone bans, right? So such interventions and policies, if they focus only on restricting time spent in social media, they may have a very limited impact on youth mental health. So I want to pause here. I'm not endorsing use of social media by any means. What I'm trying to say is that if we just limit duration, or if we just focus on how much time they spend on social media, we're missing the picture. How much time they spend does not seem to have a strong impact on youth mental health. In order to understand the complex set of experiences youth have while interacting with social media platforms, we need to take into consideration not just how much time they spend, but rather the type of content that is consumed and the nature of the interactions in social media. For instance, which platforms are they using? What type of devices are they using? Are they doing this on a large computer screen in a limited time, or do they do this with their tablets and cell phones, which are right by their bedsides, right? Time of day of use is also important because interacting with social media inevitably takes time away from other activities. If they're on their phones at 2 a.m., this replaces sleep. If they're using it at school, it probably means they're not paying attention to what's going on in the classroom. But these are also what we also have to pay attention to are visible and unknown features built into social media platforms. What I mean by that is the properties of these platforms that make them addictive, right? So now that we found that there's this strong link between sleep disturbances and mental health symptoms, let's try to unpack this a little bit. Historically, sleep disturbances were regarded as a consequence of mental health illness, but now we know that these are truly bidirectional effects. For instance, there's growing evidence that poor sleep may induce or exacerbate depression or other psychiatric illnesses. There's also a striking link between sleep and symptoms of anxiety, such that things like worry and fears contribute to a state of arousal, of vigilance, which makes it much harder for the individual to initiate or maintain sleep. And the end result is sleep loss, which further amplifies emotional reactivity. So I'll quickly walk you through a brain imaging experiment which looked at the effects of sleep deprivation on brain regions critical for emotional regulation. So this was a study done on college students. Each individual completed two different phases of the experiment. They were either sleep rested for an entire night or they were completely, totally sleep deprived for 24 hours. It started with measuring anxiety in the evening and then again in the morning. Afterwards, they also completed an affective paradigm inside a brain imaging, an MRI scanner. So while the machine was taking pictures of the brain, youth were shown emotional videos, movie clips where a strong negative emotion started to play. And they wanted to see how the brain is reacting to these emotional videos. So here's what they found. This is looking at anxiety measurements across the entire sample. in the evenings versus mornings in the sleep rested condition, which is blue here, and the sleep deprived condition, which is orange. What you see is a jump only in the morning for the sleep deprived condition, right? So they found higher reports of anxiety after sleep deprivation compared to a sleep rested condition. And when they looked at the pictures of the brain while youth were watching these negative emotional videos, they found that brain regions responsible for generating emotional responses showed stronger activation during negative movies after sleep deprivation. So again, blue here is sleep rested condition, orange is a sleep deprived condition, right? And this is looking at the amygdala, which is the emotion generation center of our brain. This brain's region is lighting up like a Christmas tree while watching negative videos if the person is sleep deprived from the night before. In contrast, brain regions that are responsible for emotional control showed weaker activation during watching of the same movies. So this is looking at the prefrontal cortex, medial prefrontal cortex, the front part of the brain, which is the executive parts of the brain, right? So these regions, which have the goal of telling the brain that don't worry about it. You're in an MRI scanner. This is just an experiment. There's no threat to you, right? So this is the information that these centers of the brain are supposed to convey. And what happens is these brain regions are showing less activation during the sleep deprived condition compared to the sleep rested condition. And they found that these two processes were related. The weaker the emotional control after sleep deprivation, the more amplified, the more unhinged the emotional response was. So we've seen that sleep loss clearly worsens mood and emotional regulation. The next question is, what aspects of sleep is actually doing the work? In other words, is deep sleep what helps you feel better? This is what the brain regions look like during rapid eye movement sleep versus non-rapid eye movement sleep. And I'll focus particularly on deep sleep, which is associated with a certain brain activity pattern. We spend approximately 20% of the night in deep sleep, and it's been shown to be critical for learning and cognition. And newly emerging work from our lab shows that it is also critical for emotional regulation. So this was a study that we published quite recently in a non-clinical sample of college students with heightened anxiety. We gave an anxiety scale to hundreds of incoming freshmen here at the University of Iowa. And then we chose students who were scoring higher on anxiety versus lower on anxiety to do a midday study with us. Through which we monitored their sleep with EEG, and we also examined their affective states. We had a task as well, but I won't spend too much time on this. First thing we found was that even though we did not recruit based on presence of any psychiatric illness, we just wanted to look at those who are who have more trait anxiety versus those who have less of it. What we found was a difference in deep sleep brain activity in youth with higher anxiety symptoms. And I won't go into the details of each of these metrics, but we found across several measures that these sleep oscillations are dampened, are reduced when youth have higher anxiety. Importantly, these differences in brain activity that we can measure only with these electroencephalography are happening in the context of no change in sleep quality, duration, or architecture. In other words, we found no differences between high versus low anxiety groups in terms of how much time they spent in each sleep stage, how well they slept, how long it took them to fall asleep, etc. It was only in this interesting brain activity marker that we were seeing the differences. Importantly, we also found that these activity, these deep sleep markers predicted affective state upon awakening. So we found that more slow activity they had during the nap, they had less negative affect and less anxiety when they woke up. And this was happening across the sample. Among those with both low anxiety, high anxiety. More deep sleep you have, the more you are likely to wake up feeling more relaxed, more positive feelings, etc. We also did a quick exploratory analysis. We looked at their sleep the night before. So, sleep duration the night before was reported by the participants, just self-report. We found no group differences in terms of how much they slept between the higher versus lower anxiety groups, but we found a great deal of variability. We had some that reported as little as 5 hours versus those who reported as much as 11 hours. And we found that longer sleep duration at night was associated with less anxiety that we measured in the lab. So that was also a protective factor. So I try to allude to this at the beginning very briefly, but I want to take home this message because that was a question that I got. And that is how much sleep is good enough for adolescents. I want to turn to National Sleep Foundation's publication that came out a couple of 10 years ago at this point with respect to sleep time duration recommendations across development. But what I want to highlight is that these are population guidelines and not necessarily exact targets for how much a certain individual should sleep. It is also well established that sleep duration is trait-like. Some youth naturally need more or less sleep. There's even a genetic underpinning to short sleepers versus long sleepers. And as you can see, there's wide individual variability within each age group across several experimental research studies that I have reported up until now. But all that aside, for the teenagers, sleeping less than 7 hours or sleeping more than 11 hours is usually pinged as something needs to be considered, something needs clinical attention. Another question I got was what I recommend in terms of improving sleep in adolescents, what kind of strategies, what to do when they report experiencing difficulties with sleep, things like insomnia, if they report having insomnia. So let me just take a moment here first to define what insomnia is. Insomnia may include complaints of an inability to fall asleep, an inability to maintain sleep, experiencing frequent awakenings without the ability to fall asleep, and waking up feeling unrefreshed, still feeling tired. But what I really have to emphasize in this context is that this sleep difficulty should occur in the context of plenty of opportunities to sleep. If there are things that are limiting the availability of sleep to the adolescent, those are the things that should be addressed first. That is not insomnia, that's a behavioral problem. There were questions about medications, and although that's not my profession, I wanted to give a researcher's point of view on this. More than 60 million Americans take sleep medications every year. And what I mean by sleep medications also include over-the-counter sleep aids, anything that a person takes to induce sleep. But the issue is the first line of intervention should never be medications. Sleep medications, particularly things like benzodiazepines or zolpidem, Ambien, like Z-meds, work very quickly to initiate sleep. But they also have several side effects, things like dizziness or daytime confusion, and they may interact with other medications. They show next day impairment, drug hangover, which may interfere with learning, attention, and cognition in adolescents. But more importantly, they cause dependency. Once the person has been on these meds for an extended period of time, they will always need the meds to initiate and maintain sleep. And what we have found across our research is that sleep medications may interfere with sleep oscillation. So, all those brain activity indices that I mentioned, which are critical for emotional regulation, they may be dampened by certain pharmacological agents. So, what should we do? What is the first line to consider in terms of sleep tips, right? So, improving sleep hygiene. And that happens through two things: education and empowerment. Youth have to feel like they're in control of their own sleep and wake behaviors. So, what are the do's of sleep hygiene? We should increase exposure to bright light during the day. We should establish a regular activity and sleep routine throughout the week and weekend. Exercise regularly in the morning or early afternoon. Set aside a time to worry, more of a behavioral control over how much worry we express throughout the day. If we have the privilege to do so, we should establish a comfortable sleep environment and try to do things that are relaxing, that are only relaxing before bedtime. Trying a warm bath is also important. So, what happens, one of the markers that our brain knows when to initiate sleep, when to start secreting melatonin, is a drop in body temperature later in the evening. If a person takes a warm bath, that temporarily increases body temperature. And while that's going down, that tells the brain that it should start secreting melatonin. So that's a way of tricking the brain into a more better melatonin production. What are the don'ts of sleep hygiene? Alcohol, caffeine, nicotine, and other stimulants. So no coffee, no energy drinks in the PM. Exposure to bright light, particularly blue light from screens in the evenings. Strenuous exercise within 3 hours of bedtime is well known to interfere with sleep quality. Heavy meals within 3 hours of bedtime. Using the bed for things other than sleep. Napping, unless the person is a shift worker and they have to. Watching the clock saying, should I go to bed now? It's very late in the morning. It's very late at night. Why can't I fall asleep? So paradoxically, trying to sleep, forcing sleep on ourselves is not productive at all. Excessive heat or cold in the room or noise in the bedroom. I want to very briefly talk about evidence-based cognitive and behavioral interventions that are proven to work for insomnia in youth. These are things like stimulus control therapy. I'll get into these details. Relaxation therapies, things like biofeedback, guided relaxation, meditation during bedtime. Restriction of time in bed, I'll talk about that as well. It is paradoxically restricting time in bed helps with insomnia and cognitive behavioral therapy for insomnia. So this combines the behavioral measures that I will talk more detail with a cognitive therapy, cognitive restructuring around inaccurate or dysfunctional thoughts about sleep a person might have. The downside is that cognitive behavioral therapy is a very highly specialized form of therapy and is practiced by only a limited number of mental health professionals. So, sleep restriction, paradoxically, spending less time in bed helps with insomnia. Let's think of this particular example up top, where orange is awake time, sorry, orange is awake time and blue is sleep time. And this shows the person woke up several times throughout the night, tried to fall back asleep. It took them long to fall asleep, etc. One thing to do is to dramatically reduce time spent in bed. And do so repetitively over several days so that the goal is to increase efficiency of sleep, to increase duration of sleep while the person is in bed. And once that efficiency is established, then gradually expanding time spent in bed. Stimulus control, what is this? Always waking up at a certain time, only going to bed when sleepy, getting off the bed if not sleepy, making the bedroom a relaxing place. So just using the bedroom for sleep and avoiding napping during the day. I can't emphasize this enough. If it was a bad day, children should not be coming back from school and taking a nap to make up for lost sleep overnight, because that is going to further interfere with overnight sleep. Another important aspect is to identify problematic screen use. So, for instance, these are examples from two separate individuals who participated in our studies. The yellow one, as you can see, is using very little social media, phone use, I'm sorry, throughout the day, whereas the one in black is using it a lot, and the use increases rapidly at night. One suggestion I have is to follow the health advisory on social media use in adolescents. This is a publication by American Psychological Association. Another important intervention strategy with respect to sleep hygiene and social media use is being good role models as parents and caregivers and being in conversation and collaboration with adolescents, so that they feel they're empowered, they're taking their own action towards better sleep. I also want to highlight the importance of winding down contracts. This is one example of a winding down plan, which starts with sitting down in a conversation with the adolescents to identify what keeps them from going to bed on time, and then taking action to prevent these steps. This particular example is from the Boston Children's Hospital webpage. So if you Google FitKit and Boston Children's Hospital, you'll get to this. And they actually have an online resource that goes beyond sleep, and it provides educational videos, assessment tools focused on not only sleep and screen time, but they also focused on nutrition, fitness, sedentary time, and stress. So I want to continue with emphasizing the importance of getting enough of daylight during the day and limiting light exposure at night in terms of being really critical as markers for better sleep quality in adolescence, and acknowledge my lab and funding that came with this. I try to incorporate questions as much as possible, but if there's any questions that I haven't gotten to, Coffee, maybe you can